we reference it as a physiotherapist as non-specific lower back pain, right? Meaning there is no reason, it's just lower back pain. That's baloney. You can't say that someone has no reason why they all of a sudden have stiffness. Now, the world then turned around and said, well, maybe it's posture driven, or maybe it's your diet, or maybe it's the lack of exercise. Now, I believe that is part of the formula and it's things that need to be accounted for. But then as a therapist that's standing there with a patient, I have to have a formula that's going to help me win in treatment. And there's two things that you need to appreciate. There is the manual therapy side of things, and then there's the exercise prescription. If I was to say manual therapy versus exercise, I would say there's a time and place for everything. But why I'd use manual therapy is more for investigation purposes. So if I do something to a joint, I reset the tissue, I reset the way that the tissue is moving, whatever it is that I do into the manual therapy side of things, and it makes a change or an impact on their movement and or their pain, well then that's how I figure out where I need to be for that step of the process for an exercise prescription.